Well, hi there, everybody. This is Dr. Schroeder with this week's video introduction to week number 2 of a course in evidence-based practice. And we're off to a pretty good start. Of course, in week number 1, our primary task was to get to know each other through the introductions forums. And so I got to learn a little bit about each of you and was happy to see that we have a really good smattering of experience in the class. A lot of you come to class with a lot of different experience and with a little bit of geographic distribution throughout the country, which always makes for a more exciting class, I think. And the first topic of discussion this week was for you to identify a problem that you have identified in nursing care, and then come up with a proposed intervention, or sort of think about a intervention that you would want to implement. Something that has been found to have been evidence-based. In other words, some research that has been found to have some data and research to show that it would be good new research to implement to lead to improved outcomes in whatever type of context, or when applied to whatever different type of population that you want to apply that to. And I was able to give everybody feedback, so each of you should be able to find your feedback in class. One thing I'll point out is it's really good to go through and make sure you review everybody's feedback and review everybody's threads, not just ones that you've been participating in, because a lot of times I'll be dropping information in those, and that's information you're going to want to review. This class more than most really depends on you sort of building and scaffolding your education up. And so these PICO questions that you started today, they're probably going to change a little bit. They'll be revised based on feedback. And it's on the feedback sometimes that I give to other students in class that you find will really help to answer a question or clarify something that you find may be helpful. The main thing to remember about the PICO is that, remember, we're talking about evidence-based practice here. A couple of you had chosen some or described some PICOs that sounded like they were just more straight research questions. In other words, what is the effect of, we have two variables here, two competing interventions. We want to know which one is going to be the better one. And that's great, but that's not really evidence-based practice. The idea of evidence-based practice is that we already have studies that show that one thing is better than another, or that one particular intervention has been shown to have improved outcomes over another. And so we want to locate that evidence. What does that evidence say? And we want to choose something that's already been done. So in other words, we should know what the outcomes are. There shouldn't be a question as to whether one thing or another is going to be better or not. We anticipate that we're going to have improved outcomes. So the outcome statement should be either an increase in something or a decrease in something, depending on your problem. But it's not just what is the effect of. That would be appropriate for a research question, a nursing research question, but in evidence-based practice, we should have a good idea. That's the whole point of implementing new practice, is we're trying to improve outcomes. So what would be an improvement for the outcome that you identify? Also, even though the time frame is oftentimes considered to be not applicable, or something that you don't necessarily have to apply, when you're working on these PICOs, think about what the time frame is going to be for your tracking. The time frame is how long are you going to track this new intervention for? And remember, we're talking also intervention on a patient population, or within a facility or in a hospital. It's not just with one patient. So the time frame is not by the end of discharge or within 3 days of surgery or something like that. Those are things that would be appropriate on a care plan, but not when we're talking about evidence-based practice. We're tracking things over a period of time, or we're tracking the data over all the patients that this new practice is going to be implemented on over a period of time. And so as you have questions, go ahead and let me know. I've gotten several emails from you, and I've from several of you, and so I've been trying to keep on top of the emails to kind of sort of guide you in on what would be the correct wording for your PICO. But don't worry about it if it changes over the next couple weeks. That's kind of the nature of the process. That's sort of the real world of evidence-based practices. Oftentimes we're refining these things as we find new information. And in week number 2, you have 2 assignments that are due. One is going to be your discussion question. The discussion question is going to focus on identifying the search terms that you would use to find information related to your PICO. and then a report back from the different databases that you used and how many hits you found. And this is where your second assignment, your experiential report, your talk with or your interview with the librarian is going to be all important. A librarian is a incredibly valuable resource to anybody that does any form of research, nursing research, health research, any kind of research, because they're really the experts on this. They're the ones that really know what are the best keywords, what are the best databases to use, where might you find information that you hadn't really thought about, and how do you locate that information? Finding information isn't as easy as it sounds. We've all been uh, spoiled a bit by Google and Yahoo. They're really good at figuring out what sort of things we want, but the Google and Yahoo methodologies don't really work very well when we're talking about finding evidence-based practice or finding peer-reviewed research, because the whole process of Google and Yahoo, it kind of tries to do the work for us. And when it comes to evidence-based practice, it doesn't work very well. Um, it is better to just use straight keyword searches, and that's what you're going to be doing, is figuring out and identifying keywords that you're going to use, trying to get a good response rate back on your literature searches, and that's going to be the primary task this week. So I look forward to once again participating in the class right along with you. I would anticipate that you should have your the feedback on your grading. It'll definitely be by the end of the week, probably by midweek. Your week one discussion question grading should be completed. Remember, I do follow the rubrics and everything in this class really pretty closely. So I'm a pretty quantitative guy. So the rubrics are kind of, I follow them pretty well. So if you really want to know on what you need to do or what will help to answer or how to answer a question or what to really address, look at the rubric. It will give you the best information as far as to how to address questions on all the assignments in this course. So I look forward to participating with you in class once again. I hope things are well with all of you, and I look forward to a great week of discussion. We'll see you in the discussion forums.